Canada, we know, has pre-ordered 20 million doses of the Pfizer vaccine with the option to buy 56 million more. The Pfizer vaccine is one of 4 being considered now by Health Canada for use in this country. Whenever one is approved, the Prime Minister says his government will be ready to deploy shots soon after. Justin Trudeau trying to reassure Canadians once again that his government is ready for a mass immunization program. Michael Serapio is on that story for us this morning. What are we hearing, Michael, in the terms of new details about plans and timelines from Ottawa?
Well, very thin on details still here, Heather, although the Prime Minister, as he spoke yesterday, was, as you say, trying to reassure Canadians that it is basically hinging on Health Canada, and once that significant step is taken of approval in this country, well, the rollout, he says, will come quickly. This assurance, of course, is essentially telling the provinces and territories that the Trudeau government, in their point of view, does have a plan here. We have to say what was shared by the Prime Minister, probably still not enough for opposition Conservatives who have been pushing for a firmer timeline on a rollout, saying that the millions of vaccines which the Trudeau government has ordered means little if Canadians are, as some have suggested, at the back of the line. Now, even the drug maker Moderna told CBC News that Canada is not at the back of the line. Trudeau acknowledging in his latest update the issue of a speedy rollout is important, but also, he says, safety must be top of mind. Take a listen.
The 4 vaccines that Health Canada is looking at right now are all undergoing a process that Health Canada has accelerated, but is ensuring that we're not cutting any corners. As we approve vaccines, we will be able to roll them out to Canadians, and we're working to do that, like everyone is around the world, as quickly as possible while remaining safe.
Now, that last point may have some resonance for people because recent polling does suggest that there is a good number of Canadians who are expressing hesitancy on getting a vaccine that's been developed in a matter of months instead of the regular period of years. And many have also said that they will wait for others to get it first before taking an inoculation themselves. For that reason, Trudeau says he wants Canadians to be assured that any eventual vaccine will not be rushed at the expense of safety, efficacy, or speed. Still, Canada's Procurement Minister, Anita Anand, she says the government is ready to receive and distribute a vaccine when one is approved here. Take a listen to what she told Vashi Kapelos on Power and Politics.
We've procured 126 fridges, to be precise, that can store, with existing federal capacity, 33.5 million doses of vaccines. In addition, PSPC is putting in place an end-to-end logistics provider. We ran a competition and we should be issuing contracts this week. We're also procuring dry ice. So we do have a plan, Vashi. We certainly have a plan.
And now we have to point out that Vashi kept trying to push the minister on a more specific timeline. Minister Anand would not actually give a direct answer on that. But interesting to note here, as we follow this Pfizer development in the UK, Heather, we know that Health Canada's chief medical advisor says the approval process in this country will follow very closely what is happening in the US Food and Drug Administration. And we know that the US FDA will be considering the vaccine put forward by Pfizer next week.
And Michael, here's something else that it's also going to follow with, it seems, in terms of who will be the first to receive these vaccines, the priority groups. What can you tell us about what Canada is looking at?
Yeah, it was really interesting to hear Cindy essentially echo, or rather say what they are talking about, who will get it first in the United Kingdom, because that really does mirror what we've been hearing from health officials in this country. It also echoes what we've been hearing from the epidemiologists with whom we've been speaking here on CBC News Network since the start of this pandemic. Again, priority here for those that are living in long-term care homes, those who are elderly, those who are frontline healthcare workers. Take a listen to what we heard from Dr. Teresa Tam.
People in congregate living situations or congregate work settings and others will be considered some of the first priority groups. Age will then come into play subsequent to that. But even amongst those, we're trying to be much more granular now in terms of as implementation goes along.
Now, we have to say, ultimately, the rollout will be up to the provinces and territories, as they're the ones that administer health care in their jurisdictions. But the Prime Minister has also essentially said that there is agreement among the First Ministers that there's going to be essentially a nationalized harmonization of policy, of priority, as they roll out a vaccine. And again, very interesting, because if the UK is doing this in a matter of days, the US FDA looking at Pfizer as early as next week. we are certainly going to be watching Health Canada to see how quickly an approval comes in this country, and then the rollout, perhaps more details, of people have been pushing the Prime Minister for.